Ipaalala na ang layunin na muling paghihigpit sa ibang mga lugar ay dahil nakakakita na po tayo ng pagtaas ng mga kaso at pinipigilan po nating ma-overwhelm ang ating healthcare system. Hinihigpitan po natin ang quarantine upang mapigilan ang pagkalat ng sakit at mapababa po ang bilang ng mga nagkakasakit. Transmission increases as more people go out and mix together. Nababalitaan din po natin ang sunod-sunod na violation sa ating public health protocols. Ayaw man po nating gawin ito, ngunit kailangan po nating limitahan ang paggalaw ng mga tao na dapat essential lang po ang pwedeng lumabas upang mapigilan po natin ang pagkakahawaan ng bawat isa. However, this will not stop the transmission. Hindi po ibig sabihin na pagkatapos ng ating mga enhanced community quarantine ay babalik na po tayo sa normal at hindi na maaring tumaas pa rin ang kaso. Especially, the Delta variant is more transmissible. Dapat manatili po tayong disiplinado, patuloy po tayong umiwas sa pagtitipon or mass gathering na maaari pong magdulot ng pagkakahawa-hawaan. Sa minsan po nating pagiging kampante at hindi pagsunod sa ating public health protocols, ay ilalagay po natin ang ating sarili at ang ating mga mahal sa buhay sa panganib. Maaari po tayong mahawa o di kaya ay makapanghawa ng ibang tao. At habang pinapatupad po natin ang mahigpit na quarantine classification, kailangan po nating gamitin ang pagkakataong ito upang mapabilis at agresibong ipatupad natin ang PDITR response and most especially ang pagbabakuna. Kasabay po ng pagdaragdag ng kapasidad ng ating mga local na health facilities upang matugunan po ang ating mga kaso. Dapat na maging mas mabilis ang ating local government unit sa pagpigil ng pagkalat ng virus. Maaari itong gawin sa pamamagitan ng aktibong paghahanap ng mga kaso. Kailangan na po nating gawin ng active case finding, magbahay-bahay, i-quarantine agad o i-isolate ang mga tao na nakikita natin na may simptomas o di kaya ay may exposure. Aside from these very critical measures that must be done in our communities, especially when cases increase are being observed, the time is also an opportunity to conduct a more targeted and further speed up of our vaccination. By more targeted, ang ibig sabihin po natin, i-prioritize po natin ang ating mga lolo at lola at ang mga taong may underlying medical conditions. Lagi po namin itong sinasabi at pinapakiusap, unahin po natin ang A2 and A3 population dahil sila po ang may pinaka-at risk na magkaroon ng severe complications or severe disease because of COVID-19. Kung hindi po natin sila mababakunahan, makikita po natin ang patuloy na pagtaas ng ating mga kaso sa ating mga ospital at maaring ma-overwhelm po ang ating healthcare system. So over to you, Lindsay.
Thank you very much po, Yusek. I will now be going through the media questions sent by our partners. From Greg Gregorio, US CDC says Delta variant is as transmissible as chickenpox. Does the DOH have the same observation? If so, what does this mean?
Yes, Greg, no? So ang US CDC, gumawa po sila ng pag-aaral kung saan pinag-aralan po nila lahat itong mga common na mga communicable diseases. Sinama po nila dito yung mga commonly na i-infect through this transmission na meron din ang Delta variant or ang COVID-19. They plotted it against yun pong spreads faster or the faster spread at saka against the more deadly. Sinama po nila dito sa pag-aaral nito ang bird flu, ang Ebola, ang SARS, yun pong seasonal flu, yung polio. Sinama rin nila dito ito pong Delta variant. Sinama rin nila ang chickenpox, sinama rin nila ang measles. So pag tinignan ho itong pag-aaral na to, nilagay nila sa isang graph. Yung graph ho nakapagpakita na yun pong mga sakit na talagang mabilis kumalat. And they are now comparing the Delta variant spread or transmissibility with the chickenpox transmissibility. Dahil pinakita dito na ang chickenpox can also infect up to 8 persons in just one sitting. So naging kapareho kaya nila kinukumpara sa chickenpox. So with this kind of analysis, yes, we agree to that. And nasa ebidensya naman po talaga na ang Delta variant po is highly transmissible compared to the UK variant na nakakapag-infect lang po siya ng mga hanggang 4 to 5 persons. But the Delta variant can infect up to 8 persons sa isa pong interaction lang ng tao. So we agree to that finding.
Thank you po, Yusek. Additional question from Greg: as we are delaying the further spread of cases with the implementation of stricter quarantine restrictions, how are we ramping up our health capacity, or where are we now in our efforts amid the threats of the Delta variant?
Yes, no. So Greg, napaka-importante. We do our lockdowns because we would like to prepare. Kaya tayo nagsasara at nag-heighten ng ating restrictions. So binibigyan niya po ang ating sistema that we can further prepare at hindi po tayo ma-overwhelm. So with this, hindi lang po ngayon, nag-umpisa na ho kami way back sa pagpa-prepare ng ating health system, especially our hospital facilities. We were able to already increase our ICU bed capacity by as much, no? Nag-umpisa na ho nung nakaraang July and August na itaas natin. Ito uli nung March and April nakapagdagdag tayo. Ngayon po may additional po tayong tinitignan around 240 na mga additional ICU beds in select big hospitals in Metro Manila. Ito pong mga ito magbubukas at magiging operational this month. Meron din ho tayong pagdadagdag sa ibang lugar dito sa ating bansa. We were already able to add additional 314 isolation beds and 210 ICU beds in Visayas. We were also able to add 190 ICU beds and 306 isolation beds in Mindanao. And in Luzon po, we were able to add 755 ICU beds and 332 isolation beds. So sa ngayon po, atin pong patuloy na pinag-iigihan na ma-expand po natin ang facilities natin dahil alam po natin kailangan continuous ang preparation. So humahanap pa rin po tayo ng mga ibang lugar at iba pang paraan to continuously expand the capacity of our hospitals. Aside from that, we are now pre-positioning medications, oxygen supplies, procurement of other needed logistics, and we are preparing additional spaces and tents for our hospitals. And of course, yung oxygen na napaka-importante, atin po talagang minamapa at atin pong ini-increase ang ating capacity to produce this oxygen supply.
Thank you, Yusek. For the next question from Jenna Balauro, can we have your reaction on the data of a consulting firm noting a serious surge in the NCR's COVID-19 cases, adding that it could indicate the community transmission of the more transmissible Delta variant in the region?
Well, unang-una, Jenna, no, we need sufficient evidence for us to declare that there is already community transmission because there are international implications to this, and we also have international definitions that we align to. So sa ngayon, wala kaming ebidensya na wala ng linkages ang mga kaso dito po sa ating lugar dahil ang ating whole genome sequencing have just detected these 200 plus Delta variants, individuals with Delta variants. But of course, dun po sa ating managing of cases, we assume that there is already this kind of transmission para mas better tayo na mag-manage, mas better na maging cautious, maging doble ang ingat, at saka mas mai-ramp up po natin ang ating efforts. So the assumption is there, but we cannot still pronounce or declare because we do not have sufficient evidence yet.
Thank you, Yusek. From Sheila Crisostomo, what is the policy now for people who have to do interzonal travels for their vaccination? Can they travel if, for instance, they are from NCR but must go to Cavite for their vaccination? May isang senior na nasa Valenzuela ngayon, pero ang second dose niya ay sa Bacon, kung saan nakatira ang isa niyang anak.
Well, it has been part of the policy and directions na kapag tayo ngayon ay nag-heighten ng ating restrictions like we go ECQ, ang atin pong bakunahan ay magpapatuloy. So ibig sabihin po, all those who will be vaccinated and have schedules will be exempted from these restrictions. Meron po silang, kasama po sila dun sa mga authorized persons outside of their residence. They just need to bring their vaccination cards or yung schedule nila ng pagbabakuna, ipapakita sa enforcers para po sila ay mapayagan na mag-travel.
Thank you, Yusek. Do you have updates on the crew of the barge and tugboat docked off shores of Albay? Na-trace na ba ang 3 co-passengers na tumakas na crew? Kasama ba siya sa Delta variant? Sa current count of Delta variant cases natin.
Yes, ito pong mga pinadala natin na mga galing sa vessel ng Albay dito po sa Philippine Genome Center. hindi po sila nag-qualify doon sa ating whole genome sequence process because their CT values were high already. Sila po ay na-isolate completely. Ito pong 5 ito. Yun pong 3 na hinahanap ay hindi pa rin po tayo nakakakuha ng report regarding this matter, no? But although they are doing active case finding right now in this area, so hopefully they were already identified or they were already isolated or quarantined based on the exposure screening that is being done by our local government units.
Thank you, Yusek from Aiko Miguel. Ilan po ang active cases ng Delta variant? Also, ilan na rin po ang local cases ng Delta at saan po nakikita ng DOH ang clustering ng Delta cases?
As to the active cases, Aiko, we have now 17 active cases. Ang atin pong naipalabas, I think yesterday, was 16, no? Were 16 active cases. Pero upon further revalidation, yung pong isang taga Region 6 ay na-classify as active case and nasa isolation facility po siya ngayon. So they are all 17 active cases. Dito po sa active cases na to, 15 ay local cases at 2 po ay returning overseas Filipino. As to the outcomes naman po for the total of 216 Delta cases, we have 190 recoveries, 9 deaths, and 17 active cases. So ito pong type natin, 165 ang local cases sa 216, 48 ang returning overseas Filipino, and 3 po are being verified if it's local or returning overseas Filipino.
Thank you, Yusek. From Aiko Miguel. Pregnant women in England are urged to get inoculated as Delta variant increases their chance to get the severe disease. Here po in the Philippines, do we have a new recommendation for pregnant women? Are we encouraging all pregnant women to get their COVID-19 shot?
Simulat sa poll, atin pong hinihikayat na talaga ang mga buntis at saka mga nagpapasusong mga nanay na magpabakuna sila. Meron lang po tayong mga guidelines para sa kanila dahil binigyan ho natin sila ng advice na hindi po pwede magpabakuna during the first trimester. Maaari po magpabakuna second trimester at pataas. Pangalawa, hindi po nila pwedeng tanggapin ang Gamaleya vaccine or Sputnik V because specific to the indications of Sputnik V, bawal po siya sa mga buntis at saka sa mga nagpapasuso. Other than that, with all the other vaccines, it is acceptable, no, na ibigay po yan sa kanila. So kasama po ang mga buntis sa ating mga vulnerable population that we currently prioritize for our vaccination. So we are encouraging lahat po ng ating mga nanay na buntis at saka nagpapasuso, magpabakuna na ho tayo kung kayo po ay nasa second trimester to third trimester para maproteksyonan na po kayo laban dito sa COVID-19 na sakit.
Thank you, Yusek. From Marites Villamor Iliano. Why was Cebu province's appeal to downgrade its quarantine classification granted? Is the IATF aware po that hospitals in Cebu City and Mandaue City are overwhelmed because they cater to all patients in the province? As of Sunday night, waiting list at a level 3 hospital in Cebu is at 33. Also, Cebu City Councilor Dave Tumulak said that some have been queuing since Friday in their cars or ambulances when they started having difficulty breathing on Sunday. The hospital brought out oxygen tanks. In Mandaue City, one hospital has a waiting list of 22. In Lapu-Lapu City, severe cases are in regular rooms because ICUs are full.
Magkahiwalay po ang classification natin for the province of Cebu as well as their tri-cities, no? Yung Cebu City, Lapu-Lapu. Ito po ay magkahiwalay and Mandaue yung isa, no? So hiwa-hiwalay po, hindi po sila aggregate na classification. So ito pong Cebu province, we have recommended that it be placed under MECQ. Rekomendasyon po yan ng ating DOH and the data analytics group. Pero ng atin pong mga local governments, meron po silang karapatan na mag-apila dito po sa mga initial quarantine classification. So ang nangyayari po na proseso, pagkatapos po natin magrekomenda base sa ating mga numero, sila po ay kinakausap ng DILG so that they can have analysis, no, sa kanila at papakita nila kung bakit ayaw or re-request sila na mas mababa o mas mataas na classification. And during their discussions with the ILG, the Cebu province have requested na they be placed under GCQ with heightened restrictions, pero magkakaroon sila ng granular lockdowns, meaning they will be implementing MECQ in specific areas in their province where they have this increase in cases. So parang hindi naman po na-negate yung ating recommendation for MECQ, nagkaroon lang ng granularity dito sa gagawin nilang pagre-restrict. At iyan po ay pinayagan naman ng IATF, and right now ang Cebu province, GCQ with heightened restrictions, but there are granular lockdowns that are going to happen where they implement MECQ in identified places.
Thank you for that clarification, Yusek. Next question from Ian Cruz. Paano i-implement ang pagbabakuna during the ECQ? Magbabago po ba ang guidelines? Mabibigay ba ang request ng Metro Manila mayors na 4 million na bakuna sa National Capital Region?
Actually, ang mga guidelines iyan are mere reiterations, no? But of course, we like to highlight ang pinaka-importante na nasa ilalabas na guidelines po natin, wala pong walk-in. Walk-ins will not be allowed. There will be pre-registration. Magkakaroon po ng strict scheduling para po hindi nagkakaroon ng mass gathering sa ating bakunahan. Magkakaroon din po ng provision dapat ang local governments ng transportation for these vaccinees, dahil alam natin medyo limitado po ang mga transportasyon kapag ECQ po ang ating gagawin. Third, there will be safe vaccination sites kung saan they will ensure that vaccination sites will have safe spaces para po sa ating vaccinees. Ibig sabihin, maluwag ang lugar, may adequate ventilation, ipapatupad ang safety protocols katulad ng physical distancing. At katulad nga ng sinabi natin, scheduling will be done. So hindi po talagang dadagsa ang mga kababayan natin sa pagpasok dito sa vaccination sites. Meron din po tayong sinabi kanina, they are considered APORs, no, or authorized persons outside of their residence. So hindi po kailangan mangamba ang ating mga kababayan na magpapabakuna na hindi sila papapadaanin sa mga kalye. They are exempted. They just need to show their vaccination cards or their schedules for vaccination para po sila ay mabakunahan. Yun pong request ng ating Metro Manila mayors. Nagkaroon naman ng commitment ang ating vaccine cluster head, si Secretary Galvez, na ito pong mga kailangan mga bakuna ay pipiliting makuha para maibigay natin sa mga nangangailangan po na local governments, not just in Metro Manila but also in other highly burdened areas.
Thank you, Yusek. For clarification, if we could clarify daw po yung interpretation with regard to the total number of active cases. 30 cases a day, ang pagkakaintindi ko ay 30,000 active cases in Metro Manila. The country's daily COVID-19 cases might exceed 30,000 if the government does not impose the stricter enhanced community quarantine in Metro Manila. Cabinet Secretary Carlos Nograles said Monday, the lower limit we were looking at even with ECQ, we were looking at projections like 18,000 a day. Hopefully yung 18,000 na yan, mas marami sa kanila, bigger majority would not need hospitalization. If we could clarify the figures po, Yusek.
Yes, no. So unang-una gusto ko lang hong ipaalala, mapaalam din natin sa ating mga kababayan na ito pong mga nire-report po natin na projections, initial lang po itong projections na naisagawa nito. Katulad po ng aming pagkakasunduan with our experts in the FASTER platform, yung grupo po na gumagawa nito, every week po ay titignan natin at i-update natin ang mga projections na to because this depends also on the number of cases or average cases that we have currently. Doon po binabase kasi yung projections natin. So ito pong nagawang projections from last week was based on the average number of cases in NCR for last week, no? Hindi po niya nakukuha pa yung average natin ngayon current. So dito po sa sinasabi ni Cabsec Nograles, ito pong 18,000 to 30,000, max minimum yung 18,000. Ito po ay yung scenario na tayo po ay magkakaroon ng ECQ. Yun pong 18,000 na lower limit, we will have 4 weeks of ECQ. And yung 30,000 would be 1 week of GCQ with heightened restrictions plus 3 weeks of ECQ. Ito po ay number of active cases by the end of September 30. So pag tinignan naman natin doon sa projections din na nagawa, meron din po tayong number of active cases for NCR per day depending on the scenario. So sabi po doon sa projections, kapag nagkaroon tayo ng 4 weeks na diretsyo na heightened restrictions lang tayo ng GCQ, we will have an average of 15,000 new cases per day in NCR alone. Pero pag ginawa po natin yung 1 week of GCQ with heightened restriction plus 3 weeks continuous ECQ, we can be able to control ito pong pagtaas ng kaso to just 758 cases per day in NCR. So again, let me reiterate, these are initial projections and these numbers may change because we are seeing that our baseline number per day ay tumataas po. So we will give you updated projections in the coming days.
Thank you for Yusek for that clarification. I will now be going through the questions sent through our Zoom chat. Ma'am, from Giselle Ricafort, irerekomenda po ba ng DOH na isama na rin sa bakunahan sa 2 linggong ECQ sa NCR ang wala sa priority list? May binabanggit daw po na gustong mabakunahan ang mga gusto nang mabakunahan ang mga gustong magpapabakuna sa NCR pero wala sa priority list.
Yes, no? So kailangan po nating klaruhin yan. According to the strategy and according to our vaccine czar, people can get vaccinated. No? Lahat ng gusto magpabakuna, maaari naman magpabakuna. Pero depende pa rin kasi yan sa supply. So even there is that commitment of 4 million doses for the National Capital Region, hindi naman po agad-agad din natin mapopulfill ito pong mga kailangan nila because dumadating ang supplies in batches also. Hindi po pang maramihan. Pero tama po yan. Pag dumating po yung supplies at mabibigay natin yan sa NCR LGUs, we will be expanding itong sectors na babakunahan natin to reach that immunity na gusto natin for this epicenter here in NCR. Pero ang tangi po naming paalala, kahit meron po tayong ganitong strategy, the most vulnerable should still come first. So now that we are trying to ramp up our vaccination, we have this kind of supplies. Unahin pa rin po natin ang A1, A2, and A3 because alam natin sila po yung maari na mas malaki ang tsansa na mauuspital pagka nagkaroon ng COVID-19 at maaring maka-occupy ng ating healthcare facilities and they will be contributing dito sa pagtaas ng utilization and might overwhelm our system.
Thank you po, Yusek. From Pia Gutierrez. Since our goal is to prevent the surge or further increases of COVID-19 cases due to the spread of Delta variant, what are the indicators that would suggest that it is already safe to relax restrictions and that we are already in the clear as far as the Delta variant is concerned?
Oh, well, we will still use the same indicators. Actually, pag tinignan po natin yung number of cases based on our average daily attack rate and our 2-week growth rate, and also we look at our healthcare system. So, kung matatandaan nyo, nung huling tumaas sa mga kaso nung Marso at Abril, bago po tayo nakapag-relax, or bago natin nakitang bumaba ang kaso, it took us, kahit na nakapag-quarantine na tayo ng strict, it took us about 1 month, almost a month, bago nakita nating unti-unting bumababa ang kaso. And that is a function of the incubation period of the virus. So na-control nga natin sila, pero syempre meron pa ring mga individuals na magtatapos ng kanilang mga 14 days of incubation and might be infecting others and so on and so forth. So what we are saying is we still use the same indicators. We use ADAR, we use 2-week growth rate, and we use the gatekeeping indicators for de-escalation, and we look at our healthcare system capacity. Although ngayon kasi tinitignan na rin natin yung mga ibang aspeto pa rin na additional indicators namin, katulad ng pending ER admission, sinasama na po natin yan, and we look at more granular data this time so that we can ensure na bago tayo mag-lift ng any restriction na ginagawa natin, ay safe na po tayo at alam natin na hindi po tayo magkakaroon ng issues when it comes to our healthcare system capacity.
Thank you po, Yusek. From ACD Calls, a consulting firm agrees we're flying blind as far as the spread of the Delta variant is concerned. He notes that the Genome Center is only able to test less than 1% of the daily cases based on the firm's sampling. 26% of daily cases are Delta, or if there are some 8,000 cases in a day, about 2,000 are Delta. The Genome Center is only able to test 100 samples a day. Does the DOH agree that we are blind on the real number of Delta cases? Yusek, I know you've explained and answered this many times, but if we could reiterate po, ano po ulit yung purpose natin when it comes to sampling po for or selecting samples po para to be subjected to whole genome sequencing.
Yes, no? So kailangan ho maintindihan ng ating mga kababayan and kailangan siguro maintindihan din ng mga research groups na nagpapalabas ng ganitong information. Ang whole genome sequencing po, the very purpose of why we do this is not for us to use this as a case management tool. Ibig sabihin po, kapag nag-genome sequence tayo, ang expectation, yung mga positive cases na sinisequence natin, ay na-manage na bago po natin pinasequence. Dahil ito pong lahat ng sinisequence po natin for whole genome sequencing, sila po ay confirmed positive cases already. So, ibig sabihin, nung na-identify sila na sila ay positibo sa sakit na ito, sila po ay in-isolate na at binibigyan na ng karampatang lunas dito sa kanilang detection na to. Ngayon, ito pong whole genome sequencing is another layer. Pagka tinest natin sila for that whole genome sequencing and we identify na meron silang variant of concern, we do community level intervention. So yun po yung pinaka-objective natin and not really for individual interventions. Kailangan din po natin ma-realize the Philippine Genome Center, although our capacity is at that level, we are doing good. Because we were able to detect these variants of concern at pag tinignan natin sa whole ASEAN nations, no? Pag pinagkukumpara-kumpara, isa po tayo sa may pinakamataas na outputs for this whole genome sequencing. Pabalikan po natin ang purpose ng whole genome sequencing. Ang objectives po natin, unang-una, makadetect tayo. May variant of concern ba tayo? Pangalawa, kailangan natin malaman, ito bang variants of concern na to are causing the rise in cases? Ito bang variants of concern na to are causing severity in disease? Ito bang variants of concern na to ang mga taong nandun sa hospital with severe disease? Sila ba po ito? So these are the things that we like answered. That's why we're doing whole genome sequencing. Now, as to the extent at saka kung sino-sino sa buong bansa ang merong Delta variant, I think we are way past that when it comes to management. We are now assuming that there are really a lot of Delta variants already and we are managing and doing a response dyan sa direksyon na yan. Dahil hindi natin kailangan ma-prove ng bawat isang tao na positibo dito ay may Delta variant. Ginagawa na po natin at hindi po natin kailangan na i-test lahat ng tao for this whole genome sequencing because that is really inefficient and no government is doing that.
Thank you po for that clarification, Yusek. From Cristel, possible po ba na i-push through ang 24 hours vaccination? Pictures of people, including seniors, lining up at night before the vaccination has been circulating.
This will depend on the specific local governments, no? So, syempre, ang mga local governments, tinitignan din po nila yung dagsa ng tao, no? But right now, that there already is this guideline and advice to all of our local governments that there should be scheduling and there should be registration, pre-registration. So madedetermine po ng local government kung ilan lang ang carrying capacity ng vaccination site niya for this time period and for this day. So maaari po niyang ma-prevent itong pag-aantay ng ating mga kababayan na gabi pa lang ay nag-aantay na para makapagpabakuna sila. Kasi hindi na ho tayo mag-aalaw ng walk-in, lahat po scheduled na. Huwag ho kayong mag-alala sa ating mga kababayan, isi-schedule po kayong lahat. And ito po mga supplies ay unti-unting papasok dito sa mga lugar na atin pong nasabi para mabakunahan po as much of the population. So hindi niyo po kailangan pumila na ng gabi pa lang dahil kayo po ay siguradong matatawag din at mababakuna.
Thank you po, Yusek. Clarification po from Greg Gregorio. Yung additional death among the Delta variant cases, is this a local case po?
Yes, Greg, it's a local case.
Thank you, Yusek. From Cedric Castillo, from GMA7, Yusek, at the rate that we are registering Delta cases, how likely is a surge? What is driving the increase?
We are seeing the increase in the number of cases already, no? In other areas of the country, nakita na natin na talagang tumataas. Sa ngayon po, meron na kaming pina-flag, katulad ng sabi ko kanina, kalahati na po ng mga probinsya natin, ng mga highly urbanized cities and independent component cities, kalahati na po sila ay nagpapakita na ng mga pagtaas ng kaso. So ano po ba ang drivers ng pagtaas ng kaso? So lagi nating pinapaliwanag, unang-una, alam natin there is this variant of concern dito sa atin, and that is the Delta variant. And we know, itong Delta variant, very transmissible siya. Ikukumpara mo siya dun sa ibang variants of concern, 60 to 100% more transmissible. Ibig sabihin, kung ang UK variant can infect 2 to 4 persons in just one interaction, ito pong Delta variant can infect 5 to 8 persons. So when you try to compute kung ilan ang magiging tao na may infect nito, isang tao to 8. So if you have 20 cases in a day, you multiply that by 8. In about 5 to 6 days, you have 160 cases. Ganun po ang projection. It's exponential. Yun po ang gusto nating sabihin. Pangalawa, alam natin, yung mga pasyenteng nagkaka-Delta variant, may ebidensya na napakataas ng viral load. Ibig sabihin, yun pong dati na viral load compared to the other variants of concern, Delta variant individuals have 1,000 more viral load. Ibig sabihin, mas mataas ng 1,000 pa ang kanilang viral load. So, yung dating 15 minuto na binibilang natin para masabi nating close contact ka, hindi na po applicable for the Delta variant because sabi nga ng eksperto natin, in just a matter of seconds, pwede ka nang ma-infect dahil ang taas ng viral load. Pangatlo, lumabas na rin ang ebidensya na walang difference between vaccinated and unvaccinated when in terms of viral load. Na ibig sabihin, talagang totoo nga na kapag ikaw ay bakunado, may infect ka pa rin. But it doesn't mean na hindi ka na po proteksyonan against severe disease. Yung panghawa mo lang ang naapektuhan dito sa ebidensya na ito. So with these three things, na a-aggravate po iyan with factors. Unang-una, mixing. Ang mga tao kapag nasa labas, of course, there is interaction. Nagkikisalamuha tayo sa ibang tao because of work, because of what we do for our essential activities and the other things. And this drives transmission. So halimbawa, ang isang tao may Delta variant, nakikipag-mix pa sa mga tao, and that becomes a dangerous situation kung saan namomobilize niya o na-facilitate niya ang transmission. Pangalawa, yung compliance natin sa safety protocols. May mixing na tapos hindi tayo nakamask o mali ang pagsuot ng mask o wala tayong face shield. And then all the more we become vulnerable to this disease and we become infected. Pangatlo, yun pong ating response din, syempre titignan natin paano po ba natin hinahanap ang mga kaso sa bawat lugar. Kailangan ma-improve natin ang ating case finding. Kailangan ma-shorten natin yung duration from identification of that individual to their isolation. So ma-shorten natin yan, mas liliit yung tsansa na yung mga taong may sakit ay makakapanghawa. So these are the drivers, pareho lang yan sa lahat ng variants of concern. Would be most different right now is that we have the Delta variant. And the Delta variant has certain characteristics na mas transmissible siya, mas nakapanghahawa siya, mas mataas ang viral load. Kaya dapat lahat mag-ingat dahil dito.
Thank you po, Yusek. From Gea Cabico, kamusta na po ang healthcare utilization in the country as COVID-19 cases continue to increase? Is the utilization rate approaching moderate risk already? Same
Yes,
question po with Sheila.
Sorry. Yes, no. So ang ating utilization rate for our healthcare, no, or facilities ay nasa 50% nationally. So andun po tayo sa level na yan, pero kailangan pinag-aaralan maigi yung granular data. NCR, other areas are exhibiting already increasing healthcare utilization. So kailangan po pag tinitignan natin ang datos, we have to be very cautious on how we interpret aggregated data. So kapag tinignan natin ang buong bansa, aggregate yan. Pero pag tinignan natin sa bawat rehiyon, ibababa pa natin sa bawat probinsya o kaya highly urbanized city or independent city, nakikita na ho natin yung mga pagtaas ng paggamit ng ating mga hospital facilities.
Thank you po, Yusek. From Jenna Baloro, pahabol lang po na tanong, approved na po ba ang recommendation na I think this was answered na po kanina, recommendation ni Sec Diza na pwede na rin mabakunahan ang mga wala sa priority list, at least sa National Capital Region.
Yes, no, nasagot ko na kanina. Yan po ang isa sa strategies na gagawin. Pero katulad nga ng sabi ko, ito pong supplies natin, kailangan titignan din ng local governments. Kasi gusto natin, priorities pa rin, unahin nila. And then the rest of the population can follow. But yes, that is the strategy of our vaccine cluster. At susundin naman po natin yan. Pinapaalalahanan lang po natin na dapat hindi pa rin makaligtaan ang A2 at A3 na napaka-importanting maproteksyonan natin ngayon pong mga panahong ito.
Thank you po, Yusek. From Sophia Toma Cruz, I think this is a very good question po. May we know po what the current time frame is now for the detection to isolation? Are LGUs able to meet the earlier target of 5 days set by the DOH? Or have we been able to see shorter duration from detection to isolation? And what are we doing to address this?
Yes, no. So Sophia, alam mo nung nag-uumpisa tayo na tumataas yung mga kaso, umaabot tayo ng mga 11 days, 13 days para makapag-detect tayo at makapag-isolate ng kaso. So just imagine, no, that length of time na nabibigay natin na chance dun sa virus na kumalat. Pero nung atin pong hinammer on ng ating local governments, bumaba po tayo. So now it's 6 to 7 days actually. So we're looking at this time period kung saan na-detect hanggang sa na-isolate. Kailangan pababain pa rin natin to less than 5 days. That would be our ideal for this time period. Kaya lang po nakikita pa rin natin yung mga variability ng iba't ibang local governments kung paano nila ma-comply, no, itong shortened detection to isolation. So what we are doing right now is we are advising lahat po ng local governments, let us do active case finding. We should not give a chance for this Delta variant na kumalat po sa ating komunidad. And one of the best ways to do that, and for us to control transmission, magbahay-bahay na po tayo. Hanapin po natin yung mga taong meron ng sintomas, hanapin po natin yung mga taong may exposure, hanapin po natin yung mga taong contacts ng mga taong nagkaroon ng sintomas o naging positibo sa sakit. This way, we can be able to identify them immediately and isolate them immediately. Hindi na po importante, hindi na po kailangan agad-agad gusto natin kasi i-test tsaka natin i-isolate. Hindi po ganun ang proseso. Isolate first and then test them during isolation. But do not let the testing delay your isolation because what's important is we quarantine or we isolate, we let them, we separate them from the population para po hindi natin sila mapayagan, makapagkalat pa ng infection dun sa komunidad.
Thank you po, Yusek. Yusek, clarification from Greg. Still 18 and above pa rin po ba ang pwedeng mabakunahan sa NCR or kasama na po ba ang mga bata?
Still 18 and above, Greg.
Thank you po, Yusek. Another clarification po from Sophia. The 6 to 7 days po ba ay national average or in the National Capital Region?
I think it's the national's average. No? So we will be posting in our Viber group ito pong granular natin sa NCR.
Okay. Thank you, ma'am. From Red Mendoza, corollary po doon sa mga projections natin, does it mean po ba na hindi na po mapipigilan ng explosion ng cases or pagtaas pa ng kaso?
With the main reason why we are enhancing our community quarantine to this hard lockdown is that objective of delaying para makapag-prepare tayo. That's the whole objective. So alam po natin ang Delta variant. Kahit tignan po natin sa ibang bansa, yung ibang bansa, they have lockdowns already for 7 weeks, pero patuloy pa rin tumataas ang kaso. Pero ang pinaka-importante, kahit magpatuloy ang pagtaas ng kaso, handa po ang sistema natin. Pangalawa, marami nang nabakunahan. And dahil maraming nabakunahan, lesser ang chances na mapuno ang mga ospital. Dahil magiging lesser ang mga tao magkakaroon ng severe infections and eventually getting hospitalized. So that is our objective why we are doing hard lockdowns. Decrease mobility, vaccinate more, prepare our system, that even though cases will continue to rise, we will see more mild and asymptomatic cases and severe infections will be reduced.
Thank you po, Yusek. Yusek, if you have the data right now, saang hospitals po i-open yung additional ICU beds in Metro Manila, or at least saan po ang majority?
Yes, no. So this is from the Lung Center of the Philippines. We have the National Center for Mental Health. We have East Avenue Medical Center, and we have Quirino Memorial Medical Center.
Thank you po, Yusek. The country's COVID-19 death toll breached 28,000 yesterday. Ilang araw na rin po na more than 100 fatalities ang naitala. Ano po ang dahilan nito at ano na po ang fatality rate ng bansa?
Sa ngayon, ang ating case fatality rate ay still below 2%, no? So nakikita natin. Pero pina-flag na po natin na tumataas po ang mga numero ng mga namamatay base po sa huli naming analysis. And this can be in certain regions of the country, nakikitaan natin ang angking pagtaas nito mga namamatay, no? So ibig sabihin, dumadami po yung severe and critical cases dito sa mga areas na to. So we are closely monitoring. Although our case fatality rate is still below 2%, we are already flagging our local governments and the public na ito nga pong mga namamatay or yung mga deaths natin ay medyo tumataas. So kailangan talaga we focus on our vulnerable, we do our safety protocols para mapigilan po natin itong mga klase ng pagkakamatay dito po sa ating bansa.
Thank you po, Yusek. From Gea Cabico, nag-increase na po ba yung number of people calling one hospital command center, and how are we handling the expected rise in the number of callers? Na-address na po ba yung previous concern na unreachable yung hotline?
I think so. We already have set up a newly established one hospital command center in TICC kung saan nakapag-hire na tayo ng personnel, equipped were provided also, and they have now started answering increase in the number of calls. Actually, hindi na lang po ng meron tayo hospital command na po tayo medicine or through the one hospital command kung saan meron tayong telemedicine providers na connected, no, dun sa kanilang system. So yes, nag-uumpisa na po tayo, and we already have ramped up ito pong mga resources na kailangan and yung ng ating one hospital. Pero amin po nga pag-uusap, kailangan pa rin natin i-expand ang capacity, not expanding the one hospital, but we should have a network with our local governments. Na ang local governments, meron ho din dapat na supplement dito sa one hospital kung saan dapat may barangay hotlines tayo para sila rin po ay nakaka-cater sa mga tawag ng kanilang mga kababayan kung nangangailangan ng mga facilities o di kaya ay nangangailangan ng guidance for their home care. So ito po ay ginagawa po natin ngayon through our DILG and CHDs para maiayos natin.
Thank you very much po, Yusek. I'll go down to the last question. Question na po. Yusek, may we ask for updates on manpower augmentation or hiring? Tuloy pa rin po ba tayo?
Yes, tuloy-tuloy po ang emergency hiring natin. Hindi po yan napuput. Actually, po, meron tayo pa rin nga po na fulfill, no? Kulang pa rin po. Lalong-lalo na po ngayon na tumataas sa mga kaso sa piling lugar sa ating bansa, kailangan po natin ipagpatuloy ito. So ngayon po, we have a total hired na mga health human resources na 9,936. Meron ho tayo mga medical specialist na kasama dyan sa hiring natin, 81. When we call medical specialists, they are your, meron ho training, no? As specialists, as doctors. So meron ho tayong generalist na tinatawag, and these are our medical officers. Doktor din po sila, 531 po ang na-hire na additional. Nurses po, date, we were able to houses, and for medical technologies, na rin po 1,156 medical technology. Tuloy-tuloy pa rin po ang ating pag-hire sa iba't ibang areas natin. We also are giving additional funds to our hospital so that they can also hire on their own for these healthcare workers that they will be needing, especially when the increase in cases will happen.
Okay. Yusek, sorry, last na po. Regardless of a person's permanent address, won't get vaccinated kung saan siya currently located. Kung saan siya currently located, have we monitored if this was implemented by the LGUs? May ilan daw po kasi na don't access residents.
Tinatawagan ho namin ng ating mga local government units. Nakapagbigay na po ng direksyon ng ating vaccine master, si Secretary Galvez. Meron po tayo napatupad na prinsipyo kung saan there is no wrong door policy. Ang ibig sabihin po nito, kahit saan po tayo nandoon, kung tayo po ay magpapabakuna, maaari po tayong bakuna. Please accommodate those individuals na pupunta po sa local governments nyo na hindi po taga doon sa inyo pero eligible naman po siya magpapakuna. So please try to accommodate them. I know a lot of local governments are vaccinating those even hindi nila residente. So sana po lahat ng local governments ipatupad natin ito para po tayo ay yung ating mga individuals na gusto na magpabakuna ay mabakunahan na rin po.
Thank you very much po, Yusek. Before we officially end our media forum, do you have any other final messages po para sa ating mga media partners and of course to the public viewing us right now?
Yes, no. So maraming salamat po sa inyong lahat. Gusto ko lang hong magpasalamat ulit sa ating mga media partners. Alam po namin, katulong namin kayo sa pagpapakalap ng tama na impormasyon sa ating public. Napaka-importante po ngayon ng panahon natin para dapat magtulong-tulong po tayo na maparating sa ating mga kababayan ang wastong impormasyon para hindi po nagkakaroon ng confusion at hindi rin po nagpapanik ang ating mga kababayan. Para naman po sa ating mga kababayan, sa paparating po na enhanced community quarantine ngayong linggo, nais po naming muling ipaalala sa ating mga local government units na pag-igtingin po natin ang pagpapatupad ng PDITR. Let's do active case finding. Let's shorten the duration from detection to isolation para po atin pong makontrol ang pagkalat pa nitong Delta variant. Pangalawa, nagpapaalala po kami sa ating mga local governments, prioritize the A2 and A3 population. This is one of the ways where we can prevent the overwhelmed system na nangyayari po sa ibang bansa at wag sanang mangyari dito sa atin. Atin pong pinapalawig ang ating healthcare system capacity, lalong-lalo na po doon sa mga areas or regions na naipa-flag na po nating high risk sa ngayon. At handa rin po tayo makapag-deploy pa ng karagdagang mga healthcare workers or additional resources also kung kinakailangan. Huwag din po nating kakalimutan as individuals ang ating responsibilidad na bilang mamamayan po, isa puso po natin at isa-isip na ang ating minimum public health standards ay makakaprotekta po para sa inyong sarili, lalong-lalo na maproproteksyonan nyo po ang inyong mga mahal sa buhay. We had been reiterating these reminders to the public. But we know na lahat po ito ay nagagawa natin na tama. Ito po ay, it works actually. Mas prepared po tayo ngayon, mas may mga armas po tayo ngayon, considering that before, wala pa hong bakuna. Considering before, hindi pa ho masyadong sanay ang ating mga doktor na magpagamot or maglunas ng mga COVID-19 patients. Considering before, kakaunti lang ang laboratorio. Considering before, kakaunti ang quarantine facilities. And considering before, ang beds natin sa ospital ay hindi pa ho ganun kadami. So ngayon po sinasabi natin, mas kaya natin ngayon, pero kailangan natin ang tulong ng bawat isa. So let us all do what we can do to prevent the further spread of this Delta variant. Magtulong-tulong po tayo at the individual level, at the community level, and of course, from us, from your officials, we assure everybody, gagawin po lahat ng ating gobyerno ang aming makakaya para mapigilan po ang patuloy na pagtaas ng mga kaso at maging handa ang ating sistema. So thank you very much to all of you. We will see all of you on Wednesday. Salamat, Lindsay.
Thank you very much po, Yusek. For the information of our media partners, we will now be doing our media forum na ulit every Mondays, Wednesdays, and Friday. And again, see you on Wednesday. Happy Monday and enjoy the rest of the day.